Our team, welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. Today we're talking all about what is a reverse tummy tuck. In the center of the weight loss revolution, we've seen so many people coming in with just that little bit of a frowny belly button. We want to turn that frown upside down. We can do that with a reverse tummy tuck. There's a subset of people that are really good candidates for this. No question that we're still doing a ton of what you would call traditional tummy tucks, which are truly high definition tummy tucks now, but for those patients that either have a really high belly button, don't really have any loose skin down below the belly button, it's really all above, and really have lost a lot of weight, don't have a diastasis. The really great thing about this is if you don't have a low abdominal scar, we can avoid putting one there. And most of the time, we can actually hide this underneath the breast. So that's why the reverse tummy tuck's been so popular. Look, it's not for everybody, but for the people that are great candidates, absolutely incredible operation. So let's dive into it. Reverse tummy tucks. A couple things I want to talk about with the reverse tummy tuck is that we're still removing skin, and that's how we're lifting that abdomen. It's really focused on the skin above the belly button. If you think about it, when you're watching us on YouTube, belly button's down here. We're using that incision down at the bottom of the breast. So if you think about it, and it can anchor breast lift. It's that bottom incision. If you're doing infrared fold breast incision, IMF breast incision, just a little bit longer incision like that, actually looks very similar. Anyone who's had a smile breast lift, very, very similar. And the idea behind that is you can take that skin out, and the beauty of this is that you're hiding that incision in that natural breast fold. For a lot of our patients that have already had a breast lift, it'll look like the exact same incision. We'll excise the scar, lift that upper tummy, and then set that down. And that's what's been so cool. That's why it's so popular in terms of transformations for the abdomen. Can we do this in combination with the breast dog? Absolutely. Definitely you can do it with the breast lift as well. A little bit more complex, few little things that go into it. Definitely have to talk about it, but there is ways to do this. Just got to make sure that we don't disrupt that fold. And then because we're pulling down, we're pulling up, we're just trying to get you right all over. Super cool to think about that. Reverse tummy tuck is basically lifting that skin up, hiding the incisions underneath the breast, getting rid of that extra skin, turning that frown upside down on your belly. So a couple things when you're thinking about a reverse tummy tuck, if you're watching online with us at YouTube, thank you very much. The goal is really that we're lifting this up and out in terms of stuff. And so to be able to do that, we just need to get everything set into a spot that's perfect for you. And when we do that, we can actually get a couple things set for you in terms of this. Is one, it's a small incision hidden under the crease of the breast. Two, we're really focused on the skin above the belly button. So we can get that up, we can move that into the perfect position. It does remove some fat, but mostly on the skin that we're removing. No question that we combine this with liposuction, we combine this with skin tightening devices such as Renuvion and Quantum, and that's very powerful because it not only tightens some of the skins, it improves the skin turgor of the areas that we're tightening. So a couple things to think about. What does it do? It lifts the skin above the belly button. It's hidden in the breast crease, which is probably one of the most attractive reasons that people are interested in the reverse tummy tuck, especially if you already have an incision there, especially if you don't have a scar in your low abdominal area. So a couple of big wins if you're a right candidate for this. When we get into this, let me show you, before we show you a result, this is what a good candidate is. Someone who has great skin, doesn't really have too much loose skin down the bottom of the abdomen, but really just has a frowny belly button. So this belly button that looks frowny upside down, some loose skin above the belly button, and then already had a breast lift and actually want a little bit of that skin taken out. We're gonna do a smile lift, reverse tummy tuck at the same time. Win-win, you're welcome. And the idea behind this is that the goal is really just trying to get this skin up because the incision doesn't cross from breast to breast. We want to protect that custom cleavage, let you wear that low-cut V-neck, maybe a bikini top, whatever you like. That tension gets pulled out. It's almost like, if you think about it, it looks like a V pattern because we're trying to pull that out and up. That way we can work it out and keep all of the incisions underneath the breast and nothing crossing the midline, which does limit how much skin we can take out completely, but still absolutely fabulous change in the right person. Someone who's skinny, definitely a lot of our patients on their weight loss journey. You've lost that 20, 30 pounds, you feel great, you look great, just maybe a little bit of sad belly button, a little bit of loose skin above the belly button, right underneath the breast. Perfect operation for you, be able to treat all of that. You keep this picture in mind if you're watching us on YouTube, watching us on one of the Instagram reels. I think this is something that can make a big difference for a lot of patients. And again, this is someone that doesn't have a huge diastasis. It's just looking for a subtle change where we can hide it, be our little subtle, sexy secret, if you will, in terms of that tummy tuck lift stuff. Let me show you a result in treatment that people get. So reverse tummy tuck, right? If we get back to who is it good for, if you look here with me, someone who has some skin laxity, lost a lot of weight. This person lost about 40 pounds, living fit and fabulous. Now wanted her tummy to look as good as she felt because she's working out all the time. She's eating right. She's been on her GLPs. And so ready for the finishing touches. Just a frowny belly button, just not where she wants it to be. Right after surgery, you can even see the marks I make. So the direction that I'm angling, all that pull, and then I over accentuate, but really just tighten everything underneath the breast so that way we can get it up, hide it underneath the breast, make sure you're in a good spot with all of that. You can see, if you're watching on YouTube with us, how much it opens up the belly button, because to be able to open up the belly button like that is absolutely huge. It really, really transforms the tummy, transforms the entire abdomen into a great spot. And then when we come here, this is her result about 3 months out. And if you look at this with me, I'm gonna get rid of some of these yellow marks so you can see this, is that you can see all of her true definition coming in because we did a little bit of skin tightening, did the reverse tummy tuck. The goal of this is that you're working really, really hard. We wanna show all of that off. And so by being able to lift that, you don't have any of the low abdominal scars. You've opened up that belly button. You've made that skin really tight. So now if you've done your hard work, you've got some ab muscles, you've got some of these things, it shows it off. And you can still wear that bikini top because everything is just hidden underneath the breast. And especially like I mentioned earlier, if you already have a breast lift, you already have the scars there. We cut those little scars out, pull that skin up, get you into a great spot. So hopefully that helps. Reverse tummy tuck is basically lifting the skin above the belly button with incisions that are hidden underneath the breast fold. Great for people who are on their weight loss journey. Great for people that just have a little bit of skin laxity, not a big diastasis, more rapid recovery than a traditional tummy tuck, and more subtle, sexy secret incisions, if you will. So Plastic Surgery Untold, talking all about reverse tummy tucks today. Listen to us anywhere you get your podcasts, iHeart, Spotify, Pandora, or watch us on YouTube because I did some great explanations here. All right, we'll see you guys soon. Bye.